When did you tell him your plans were with Dr. O'Malley? When I had seen Dr. O'Malley, I saw Dr. Finkelstein, and he was sending me for a few tests. Defense counsel, objection, Your Honor. It is a hearsay objection. The court, I'm going to allow that. Go ahead. Defense counsel, exception to Your Honor's ruling. He, Dr. O'Malley, was sending me for tests before he would do surgery, so I explained all this to him and what kind of action I was going to take. That's about it. Were you planning on getting surgery at that point? I was seriously thinking about it, yes. Okay, were your symptoms getting any better or worse than when you started treating with Dr. Finkelstein? They were getting worse. And how long did you treat with Dr. Finkelstein? How long? Yes. Defense counsel, I object to this line as unusual. Defense counsel, exception. The court, answer the question, please. I have been treating with him ever since. Okay, and you treated with him recently? Yes. What's the next thing that Dr. Finkelstein did to you in the course of your treatment of him after the February date? He put me in the hospital a few times. Do you recall when your first hospitalization was with Dr. Finkelstein? It was the 22nd of March. Okay, and what did he put you in the hospital for? Defense counsel, I object to the question, Your Honor. The court, it is objectionable, but I will allow it. I had an epidural placed into my spinal cord, and they bathed my spinal cord in steroids. Okay, and was that an oversight, or did you stay in the hospital? That was the same day. What hospital did you do it in? Syosset. All right. Now, when before he put you in, were you still taking oral medication? Yes, I was. Were you still working at the time? At that point, I think I was still working. I think I was also trying to still work. And were you still seeing the psychologist, or was it only that one time you saw him initially? No, I saw the psychologist a few times. Okay, were you seeing Dr. Finkelstein on a daily basis, weekly basis, or as needed? At this point, I was seeing him weekly. After that first hospitalization, what did he do? I had gone in for another procedure, probably about a few weeks later, for the same procedure again, but because of the severe reaction with the steroids, he decided to do a saline epidural. That is the same procedure, just a different medication. Okay, and again, he did that in the hospital? Yes. And then did he do it again? Yes, he did the third one at the end of March, and this one was a 3-day epidural, and along with 3-day epidural with the saline was a phenol drop or drip that also went into my spine. Did you get any improvement from this? No. What did you do after that 3-day hospitalization in March? After that, I still continued to treat with him. During this period of time, were you getting any physical therapy? Yes, I had some physical therapy. Where did you get it? I went to the sports center. Where is that? That is in Babylon. Up until, say, this third, and this is the third hospitalization you had? Yes. Is that correct? Yes. After this last hospitalization, which was just testified to, what then happened next in your course of treatment with Dr. Finkelstein, Defense Counsel? Your Honor, we have gone all over this before. I object to it. Overruled. He placed me back in the hospital again toward the end of March because the pain was just so severe at that point. I couldn't tolerate it, so he put me back in, and he started me on very high doses of narcotics. He put a patch on, a fentanyl patch, on me also at this time. I was having trouble urinating. They had to put a Foley catheter in me to drain my bladder. How long were you in the hospital at this time? I believe it was about 2 or 3 days. During this the end of March, beginning of April, was the treatment done? Yes, it was. What happened next in your course of treatment? early in April, I believe around April 5th, 2001, I was brought to the emergency room in Plainview that night. All right, this happened before or after your surgery with Dr. O'Leary? This was after. All right, so after you went into North Shore Plainview for the 4th time, they discharged you. What was the next time that you did with respect to your treatment? That is when I had my major back surgery. You say major back surgery? That is correct. Okay, so in other words, this detox hospitalization happened a year later? Yes. Okay, so you were out of work? I'm sorry. The court, that was April 5th of '01. Yes. Yes, Your Honor, so after your hospitalization, North Shore Plainview, for 3 days, the next thing you did was you had major back surgery? Yes. Tell us, so, from April to August, what were you doing with respect to your care and treatment? At this time, at this point, I was practically on bed rest. I was getting such numbness and tingling in my legs. Sometimes it was very hard for me to stand because I didn't feel anything, or the pain was just shooting up and down, and it was hard for me to walk or pretty much do anything. So I was on very high doses of medication. I didn't leave my house and all. I was still on antidepressants and antibiotics.
It's okay.